Good evening and welcome to Talking Teeth Thursday. And I don't know where the time goes. We're week into November already. And just for change, I thought I'd do something a little bit different this month. So really comes on the tail end of last week's post. So we asked you about how you feel about your smile. And, it's one of those questions that often your dental team will ask you. And they say, how do you feel about your mouth? How do you feel about your teeth? Is there anything you feel can be improved that you would like to improve? So it's sort of following on a little bit from them. And as you can see, I've sort of got some bits and bobs from my other life. And no doubt I will regale you with a few stories along the way this evening. But anyway, I'm going to talk a little bit the following tonight and the next few Talking Teeth Thursdays about dentistry, about you visiting the dentist, and maybe give you a little bit of food for thought as far as what actually goes on before treatment. So before you park your rear in the chair, that wonderful place that everybody just loves to be, the best day out ever, said no one, I don't think. During your actual treatment, and that can be from when you go for your oral care assessment, oral health assessment, what a lot of people refer to as a checkup. So, but it really is an assessment of your oral health, to maybe having some treatment. And then once you leave that chair, once you get out of the dental chair, what actually happens afterwards? Because what happens afterwards affects you if you happen to be the next patient. And actually whether you need to come back, all those sorts of things. So in the end, I sort of thought, you know me, I go down these rabbit holes, and off I went down this one. And I thought, something, I don't know that people really know a lot about backstory, the background in a dental practice and a dental surgery. And it's not that I know everything, because I don't, and things are constantly changing, things are constantly updating. But I just thought we should talk about this a little bit more, because some of the most common complaints I hear about dentistry is can't get a dentist, or the only dentist I can get has gone private and it's so expensive. And why is it so expensive? Because I pay my taxes. And something, dentistry is not cheap. And the overheads of running a dental practice have escalated. And I'm going to talk a little bit about why so many dental practices have gone into the private area, private arena. But what you've got to remember is that dental practices, by and large, are small businesses. Now, they are bought by corporates. It's not just dentists that can own a dental practice these days. Dental care professionals can own a practice. So you might be going to a dental practice that's actually not owned by a dentist. It's maybe owned by a corporate. And there are plenty of those. So, we've got Clear Dental, we have got Bupa would be one of the big ones. So there's lots of corporates that are buying dental practice, and that's a relatively new phenomenon, because that legislation only came in for, I can't remember exactly the date, but certainly in the last 20 years. So a lot has changed from that one man, one woman show. So, those practices that were basically one man bands. And they maybe had a reception or a nurse or somebody that actually did both jobs, and the dentist, and that was the sole clinician. I did a Talking to Thursday, not sure how long ago, but you can search for it if you want to, on the dental team. And actually, it might be quite interesting to see how that team has evolved. And one of the things I often say when people go, I don't know if I only want to see a hygienist or a therapist or treatment coordinator, I'm going, something, if you had a bad back, would you go to the doctor or would you go to the physio? So, medicine has become a much greater team sport, as has dentistry. So you can be treated and managed and cared for by the best equipped, best qualified, most experienced person to do that job. And they may be experts of their little part of dentistry. But if that little part of dentistry is the bit that you need, you want to be seen by that individual. So let me just share my screen, and we will meander through this, and we'll see what pops up. So where am I? Yes, I'm on screen too. This is typical me. And bear with me because I'm absolutely loaded with a cold and almost feeling pretty rubbish. But like the page, share the page, like Talking Teeth Thursday. So here we go. What I want to tell you. Am I sharing the screen so soon? I want to say, oh yes, I am. That's what I like to see. Yeah, because sometimes with me, you're never quite sure what you're going to get. So this was the post that I only got around to doing this morning, just because it's been one of those weeks. And we are going to talk this week about what happens before you actually park your rear in the dental chair. Next week, we're going to look at during dental treatment, and then the 21st, we're going to look after. And then the 28th might be something that a lot of people will be really interested in, because I'm going to talk about dental anxiety. I'm going to talk about the fear of dentistry, the things that worry you. And to be honest, I have yet to meet somebody who thinks it's the best day out. If I give you a choice between going to the dentist for the day or going to a spa, I'm pretty sure which way you will veer. But that said, I do want to address that. And again, I'm not an expert, but I can give you some tips. I have worked with a huge number of people of all ages who have at least an anxiety, and in some cases an all-out phobia to dentistry. And often with that, if something's happened to a child, but let me come back to that in due course on and when we get to that point. So dentistry is a team sport, so we're going to look at actually what happens before you actually get there. So a bit of background, a bit of context for this. The majority of dentistry in the UK is provided by and large by high street dental practices. So that would be Mr. Blogg's practice, Mrs. Blogg's practice, Smile practice, whatever, often by location. Sometimes they'll have a quirky name, so there's Healthodontics. So there's all sorts of things that actually say a little bit about what they offer. But they're basically high street dental practices. They are often found in your locality, and some of them will provide solely NHS practice, some will provide solely private practice, some will provide a combination of both. It's not the only place that you will get dental treatment, though. By and large, there are other locations that you will get dental treatment. So you might find dental treatment in a hospital setting. So that can be in a specialist hospital setting. So it might be a maxillofacial setting. It might be something like a children's hospital. It would often have a dental unit. A major teaching hospital, so it might have a dental school that you may receive treatment from students. There's a number of variations from a hospital setting, depending, who those individuals, those dental team members that work within that environment. The other place that you will find dentistry is community dental services, the community dental clinics. And these are what were traditionally known as the school dentists. And they were the ones that went out to the schools and they gathered a lot of data. They did assessments in schools. So they actually did school screenings. They screened the children. And it used to be the whole school was screened. Then it was reduced to certain year groups. And now it tends to target those children that are at risk, at greatest risk. So there's a number of different places you can find dental service. The other one that's popping up again, and I always say, if you sit around long enough, everything comes back to you, is a mobile dental unit. And you might have seen this with some of the charities. So Dentate have had a mobile unit that has been taken out, and this is basically a dental surgery in wheels, for want of a better way of describing it. And it's been addressing local dental needs where there has been a dire shortage of dental access. And that is the big problem, is dental access. And we all tend to think, oh, well, I pay my stamp, I pay my taxes, I should be entitled to free dental treatment. And that is all very well. But the problem is each of these high street dentists, not pretty much what I'm going to sort of direct things to today, although the basic principles apply to any dental environment. But these practices are small businesses. And not unlike, your doctor, and you've heard about doctors handing back their NHS contracts. But what you have within dentistry is they provide services to the NHS or not. And the NHS pays them a fee for providing those certain treatments. And most adult patients in the UK these days will actually pay some amount towards their NHS dental treatment. And the theory is that NHS fee will cover, enough of your dentist's costs and leave some profit to get your dentist to treat you, do the treatment as necessary for you to obtain and maintain good oral health. And that should be available in the NHS. Now, interestingly, historically, way back in 1948, when the NHS actually was created, everybody had free dental treatment. And I think it was about 1951, certainly the early 50s, that some fee was brought in for people attending dental services. Now, there've always been exemptions, and there probably will still be exemptions. But for the most average adult, you will pay something towards NHS dental charges. The catch now, and this is one of the reasons why you will see more and more of them going out of doing it, leaving NHS dentistry, is the introduction of new contract by the government in 2006. And that has had the biggest impact on the availability of NHS services since then. So, as I say, initially it was free, then we had an introduction of some charges way back in the 50s, and those charges have escalated. But with the new contract, early 2000s, what happened was the fee that was being paid to the dentist didn't equate with the costs that it was to actually provide the treatment. And it's not just, actually physically in the mouth, it's all the stuff in the background. And that's one of the things I want to sort of have a look at this evening. All those things that go on that you are probably in many ways totally oblivious to. And a lot of them have been generated sort of by external sources, for want of a better way of describing it. So the certain standards of the regulations and the standards that dental practices have to adhere to have been, set about by another body, so to speak, and all these things have to be complied to. And it's like any sort of like health and safety generally. I mean, where was health and safety 30 or 40 years ago? People climbed up ladders, wandered around roofs, not thinking. Now a business could not actually do that without getting into serious trouble. So a lot of the movement out of the NHS has been down to cost, really, and what the NHS dentistry has provided. It varies in different parts of the UK. How it's paid is different, so it's as clear as absolute mud. In some parts of the UK, it's banded, and they're paid under a system called UDAs, which always amuses people in Northern Ireland, because if we'd had UDAs, we would have had to have other lettered acronyms because of paramilitaries, but let's not go there. But we had health service dental bands, and the problem was that these don't always cover more complex treatments or, more developed treatments, because how we treat teeth now, how we actually can restore teeth and treat gum disease and other things within industry is very, very different to how it was 30 or 40 years ago. And I mean, this is within my professional lifetime. So all these things have changed, and people's expectations of what they want as far as dental treatment goes has also changed. So a lot of things to do with cost has actually got very confusing. And as I say, even within the profession, I think there's a lot of people are really confused. But basically, the fee that's paid by the NHS does not actually cover the cost of providing the treatment. That's what it really boils down to. So before you get to the dental practice, you want to make an appointment. You want to do your homework on what kind of practice you want to see. What do you expect from dentistry? Do you want a practice that is very orientated towards prevention? I would be that person. Do you want a practice that is very focused on cosmetic treatments? So you want to have Dulux white, dead straight, great, perfect teeth. What do you want? And that goes back to the post at the end of last week that asked you about your smile. How do you feel about your smile? What do you like, what you don't like? So, a lot of that is food for thought. When you're ringing to make an appointment, particularly if you're a new patient, If you've had a bad experience, if you're nervous, or you're in pain, you always want to tell them that first. It's really, really important. And even if you're not a new patient and you're ringing to make an appointment, if you have pain, please tell them. There is nothing worse than somebody coming in the middle of a busy day that is in for a short appointment because they're there for their oral health review or a checkup, for want of a better way of describing it. They come in and they say, oh, I've got pain. You haven't left long enough to actually manage that. And of course, you're not going to leave somebody in pain. So the dental team will actually address that to him, but then that has a knock-on effect for those people coming behind, and that's where waiting times get increased. So just a little reminder, kind reminder that if you have got a problem or there's something worrying you, please ring and let them know before you get as far as the front door. It really makes a big difference giving them a heads up. So let's look a little bit about all the stuff that goes on in the background. Let's just take the building. I mean, you're talking about bricks and mortar, and often the dentist will buy that building and practices are sold on to other people and they may need to modernize. There are some practices that are built from the ground up specifically to provide dental care. But you're talking about bricks and mortar, so the building in itself and all the things that go with owning any building, any property, comes into that with maintenance and insurance and all that sort of stuff. So that's it. Keep in mind that this is also a business. You've got the cost of putting in a surgery. Nothing within dentistry comes cheap. Believe me. Dental chairs, the actual equipment of suction, and all has to be created and fitted to very specific standards, and that's in your best interest and the dental team's best interest. The whole thing has to be kitted out, including now we have to have a decontamination sterilization area. So in years gone by, you would have found, let me see if there's a picture of a sterilizer. Oh, I think there's one way down there. You would have maybe found that in the corner of dental surgery. No longer. That will be in a separate room or a separate area, and that is to help improve the efficiency of and controlling cross-infection. So, was one of the interesting things with COVID was dentistry had the highest levels of disinfection and infection control. And, it's one of those things that, we started there and then went on up there. So interesting, but these things are all written down. There's standards by regulatory authorities, which the standards tend to be the same. The authorities tend to be slightly different in different parts of the UK. But some dental practices have to tick all those boxes, and they are visited on a regular basis, and they have to fulfill each one of these certain criteria to practice. It goes with their x-rays machines. All these different pieces of equipment have to be monitored and maintained. So you might have one surgery, you might have two surgeries, you'll have a reception area, you will have a decontamination decon room, you may have a staff room, you may have a kitchen. So different places. You might also have something like a room for maybe health education or a treatment coordinator to work in. You might have a recovery room if you're offering some sort of sedation. So it might be quite a dynamic building to begin with. As I say, the whole thing, it has got to be equipped properly for the purpose. Even floors have to be a certain way. Yeah, I mean, you can't put things on the walls the same way as you used to be able to. So a lot has changed. So if you haven't been to the dentist for a number of years, you may find it looks quite different to the dental surgery of your childhood. And, for reasons that, it's meant to keep us all safe and keep us all well. What other costs are there? So before you get in there, you want to have suitably qualified, experienced and knowledgeable and highly skilled team of dental practitioners and nursing and support staff. So that can come from a practice manager, reception team, dental nurses, and dental hygienists, dental therapists, clinical dental technicians, I'm bound to have forgotten somewhere, treatment care coordinator, health educator, and again, I say I'm bound to have forgotten somebody, and I apologize if anybody happens to be listening and I have forgotten about. But you know, there is this whole team of people who prepares the surgery, who prepares the practice and manages the practice to give you the best care possible. Now, once they've qualified, that's not where the cost ends. They have to register, and they have to register annually. So they have an annual renewal with the General Dental Council. That has to be, so they pay their annual retention fee, their ARF. They have to make sure that they are keeping up to date, which you would definitely want. So they have to do X amount of continual professional development every year, and they have to fulfill certain topics within that. And again, really important, so things like basic life support, you know, so they have to know how to give basic life support and first aid to somebody that collapses, because, you know, I mean, if you're nervous and you're anxious, quite possibly you may faint in the dental surgery. So as I say, there's things like that that they have to fulfill. So there's a large amount of money that goes into that background there. Then sort of beyond the basic sort of surgical type things, you will find that maybe they have digital radiography, so digital x-rays. So instead of your x-ray coming out in a little square of black paper and it gets stuck over a light viewer, they may all come up on the computer screen now. And most things within dentistry have gone to digital software, whether it be managing patient records to x-rays, all sorts of things. You might find that they have a scanner, and that's the scanner there being used. And basically it's an alternative to an impression, but what it does do is give a three-dimensional image of your mouth, and it is hugely detailed. It's a great way of monitoring wear. It's a great way of giving information to a lab if they're making retainers, aligners, night guards, all sorts of things. So they're a great bit of kit. You might find that they have, you know, a different type of x-ray machine rather than just the tube that comes against your face. They might have something like this, the OPG, particularly if they're doing orthodontics. So there's an awful lot of investment goes into the background before you get as far as sitting in that dental chair. So sometimes it's worth remembering that, you know, because you want to be looked after by the best people. But sometimes, you know, we forget about all that stuff. And for some reason, I do not know why this is. This is going to change. Oh, we'll do it that way. That's all right. Don't ask. Anyway, so what else goes on in the background? Well, you know, the surgery all requires equipment, and it's not just the big pieces of equipment, but instruments. There's a huge number of disposable pieces of equipment now, and that's down to, again, things have changed. So, you know, if you're my age, you might remember going to the dentist and they didn't wear gloves. And I qualified it. We didn't wear gloves. That was a reflection of my age. But, you know, so they disposable things like gloves, masks, you know, other aspects of PPE, so safety glasses for the patient, safety glasses for the operators, handpieces. And you need to have enough of all these things to see a number of patients in a session, whether it be morning or afternoon. So it's not just one handpiece. That handpiece has to be decontaminated and sterilized before it goes into the next patient's mouth, which of course we'd all want. And again, so you're talking a number of these, and these are expensive bits of kit. Suction tubes, instrument trays. So the instrument trays sort of might come up something like a variation of what I have behind me. Sometimes they tend to be set up when they come out sterilized. The nurses will check them that they're all clean, and they will be set up in such a way as this is for doing a filling, or this is doing a root canal, or this is for an examination, for different things. Pardon me. So you will find different kits set up for different things. Pardon me, bear with me 1 more second. Oh, not quite sure what's going on here. Oh, I don't know where that came from. Let's take that out of the way. Anyway, so you have instruments, kits, and all these things have to be stored properly, and they have to remain clean, and those things that have remained sterile are kept sterile. So things like mouthwash cups, for instance. Now you will see, because of the amount of plastic waste within dentistry, there's an awful lot more practices are becoming much more aware of the sustainability, and actually changing to cardboard cups or reducing that need to rinse and spit. So you might find some your clinician will rinse basically your mouth with their water spray to the 3-in-1 syringe, and then just ask you to spit rather than actually have that plastic cup. Or people are using metal cups. So these things, again, a lot of this disposable stuff came about with CJD, and the necessary to switch to a lot more disposable equipment. So in the years gone by, we would have had metal suction tubes. So these are the things that suck the water out of your mouth, and they would have been cleaned, and they would have been sterilized, and then they would have been reused no longer. So there's an awful lot more of this single-use item, which is not good for the environment. But as yet, I know there's a lot of people looking at it, but as yet, we're not really coming up with a very good solution. So as I say, a lot more disposable. Things like HIV, CJD, a whole lot of those things changed an awful lot within dentistry. And high-speed suction is one of the best ways of controlling that splatter that goes around. The cost of materials, again, think about what you buy and where you think about going to the supermarket. You can buy own brand, or you can buy the top of the range, the finest range, or depending on where you shop. But again, there's a variation within that theme. And likewise within particularly dental materials, you've got your basic quality, and you've got that elite quality. Some clinicians love certain materials and will only use certain materials. Others, will have their preferences. So I say there's an awful range of those. The cost of those has increased. Brexit hasn't helped, I don't think. And so I say there's all those sorts of things. But before you arrive, the team need to get in there, check equipment, make sure the right instruments are ready. If you have lab work coming back, so if you're having orthodontic treatment, you're having liner treatment, they will want to make sure that the things have come back from the laboratory. They will want to check, do you need x-rays? How long ago were your most recent x-rays? They may use an intraoral camera to have something like this to actually look inside your mouth. And that's a great way of letting you see what is going on inside your mouth as well. They may have some images they've taken of your teeth. Again, that is becoming much more common these days. But whatever is set up for your visit has to be clean. And usually the day before, the team will get together and they will look at the day list for the following day. So when they look at and they see your name and they go, what do we need for you who? And you who will need, they haven't had x-rays for 4 years, so maybe we need to update the x-rays so we've got something to look at and compare things. They were talking about having some orthodontic treatment. Is there anything we need? Was that they were referred to Joe Blogs. What happened with that? Did they actually see that? What happened there? So communication is really, really key within the dental practice for the team to be prepared to look after you properly. It is very much the teamwork really does make the dream work. And nurses in particular hold the whole thing together and often keep the whole show on the road. Reception staff and the dental nurses, and often they can be duly qualified and be utilised in both areas of a practice. But they basically are the glue that just keeps the whole thing moving. The honey that sticks us all together. It's not a good analogy, sugar, is it? But anyway, let's not go there. But it does need the clinicians and all the support, the nurses, reception, everybody to work together for the whole thing to run smoothly on a day-to-day basis. Some clinicians will like their dental nurse to go through the diary the day before, work out who needs what, if there's any materials that need to be held, because there's nothing worse than asking for a something and it not being available. So all those sorts of things are important. And that's one of the reasons why when you ring up to make an appointment or you ring to confirm an appointment, because an awful lot of that now, that, you know, you'll get your appointment, you might get a text message to confirm you have an appointment tomorrow at 2 p.m. If you know you have an appointment tomorrow at 2 p.m. and it's for your checkup, your oral health assessment, your oral health review, and you have developed a niggle sort of ache thing that sort of comes and goes, and you think, oh no, I'll tell them about it when I get there. Please take the time to ring them and say, by the way, I'm coming in to see you tomorrow, but I sort of have a niggle, or I've got sensitivity, and just to let you know if you need to leave a little more time. Really, really important. I do know something that will be so much appreciated by the dental team if that is the case. So let them know if there's an issue. Okay. And what you'll find is the day for the team will start way before the first patient comes through your door, because everybody needs to be in and be prepared. Reception staff will be picking up any messages that have been left overnight. The nurses, whoever's in charge of decon, will be running decon tests to make sure that the decontamination sterilization equipment is all running to standard, because otherwise we don't know if it's sterilized or not. So all those things need to be done. Surgeries are being set up, everything needs to be checked that they're working. So water lines need to be run through, and the right instruments need to be available. Any stock that is required in surgery might need to be brought from other areas. Basically make sure everything that is required for that day is where it should be and is accessible. Trays need to be made up. Fridge temperature of the fridge might need to be checked. And on a regular basis, maybe not daily, things like the drugs box for emergencies, medical emergencies, they all need to be checked that they're in date. The defibrillator is accessible. The oxygen cylinder is full, and it's with use, all those things. And what you may know is, I mean, dental practices should all have a defibrillator, and they will have oxygen, free flow oxygen, and they will be trained to deliver basic life support, and that includes CPR. So, you know, if you're going to become unwell, dental surgery is quite a good place to have it. But things like light curing machines, you know, particularly so many of these are now battery powered, so rechargeable, making sure that those are charged up, because there's nothing worse than trying to cure a material, a filling material, and the power runs out. So all those things need to be done before you get as far as the dental surgery. Give me 1 second, I just might. So often what you'll find is dental practices have, some of them call a morning huddle. Some people just have a cup of tea and a chat, but it's a moment or two just to gather breath in the morning before any patients arrive, just to discuss the day ahead. And that is one of the reasons why it's really useful when you make an appointment, you give the dental team as much information as is possible, because the more they know, the better they are going to be prepared for you. I'm going to come in a minute to what you need to do before you actually put your rear end in the dental chair. But many dental practices will now use electronic software to manage their patient records. They will have an appointment system that will maybe connect to a text system, messaging system. So all these things that we've got really technologically orientated now. And it's much better, because if you have to be referred, say for wisdom tooth extraction, or you've got your dental team say a white lesion, which they're suspicious, they're concerned about, and they want to red flag the referral because they worry it might be mouth cancer, they can do that all digitally. They can take a photograph, they can attach it to your chart, which stays with your chart. They can send all the information digitally. There's a lot of that has improved now. We don't have to rely on Royal Mail, who can have the odd hiccup, as we well know around here. But, you know, a lot happens before you go through that door. And as I say, I've probably forgotten some. But, you know, I always say teamwork makes the dream work, and that team includes you. What about you? What do you need to think about before you actually get through the door? Do you know something? If you're not well, reschedule. If you're not fit enough to go to school or to work, you shouldn't be attending a dental practice. And I could tell you some very interesting stories over the years where I have seen people that's come in and, oh, they were off school today, didn't send the school, not well, but I came anyway. And yes, we wear PPE, we're well protected, but that doesn't necessarily mean that other people in the waiting room are, and other members of staff may be vulnerable. So please, if you're not well, and you're not going to work, if you're not going to school, you shouldn't be going to the dental practice either. And that is really, it's surprising while I think that's common sense, it's amazing how often that is overlooked. And preferably, I mean, obviously there may be fees and things related to late cancellations, but I think most dental practices, if you're genuinely unwell, they don't want to see you in anyway. But the other thing is arrive in good time, okay? You have a number of boxes to tick before you put your rear end in the chair. So make sure you are there in good time. So don't arrive exactly on the moment of your appointment time and then decide you need to go to the loo and then get sitting down to do your medical history form, and then try and think, oh gosh, I haven't remembered brought X, Y, and Z that I should have brought. Please make sure, and I know plenty of times you can be kept waiting, but usually that's for a good reason. But if you can be on time, that's much appreciated. Please clean your teeth before you come. That probably is the single most appreciated factor. It will not only be appreciated from the point of view of people can see your teeth, it also makes it much easier to actually look at your oral health. And if you've only cleaned in between your teeth, brushed super well for the previous 2 or 3 days, don't think that's going to cut it, because your dental team will know. They can still spot inflammation. So I'm not going to go through all that now, but yeah, clean your teeth before you come if you can. I appreciate sometimes that's not always possible. If you're taking medication, it's really useful to have that written down, because sometimes going to the dental practice can be quite stressful for people, and it's easy to forget things. So have a note of medications, because your medical history will need to be completed before your dental team actually look in your mouth. So you want to be upfront and honest and give as much information as you possibly can. So not just things that you've been prescribed. Really useful if you've been prescribed a medication, of how much you're taking and what you're taking it for. Often medications can be used to treat a number of different conditions, so it can be really useful to do that. Be very honest about your medical and social history. So in other words, if you smoke 20 a day, please say you smoke, or you vape. Please make sure that's in there. Again, likewise, your alcohol. And if you've listened to me ever before, you know the importance of those things in relation to your oral health. So really important to have a note. Even things like if you've had a recent hospitalization. So I mean, I've been in a situation that somebody's come in, they've literally tick boxed the medical history form, and then when we start to chat, find out actually they have had a suspected heart attack the week before. But how do you define that, or the way the particular medical history form was structured? So as I said, it's really important to make sure that your clinicians, your dental team know, and that makes them much better prepared. And certainly from a medical emergency point of view, the more thorough your medical history is, the better that your dental team can be prepared to actually help you through what can be quite a stressful situation. Other things like supplements. So if you self-medicate, and I mean, thinking something like aspirin. So if you take aspirin every day, it's not been prescribed, but that is something, again, your dental team will want to know, because you're more likely to bleed. So things like that are really useful for them to know. So anything that you use, I mean, even sports nutritional supplements, things like that are really useful. So I would work with a number of sports people and sports groups, and particularly with power and strength training, they would use protein shakes and that sort of thing, and that can be reflected in their mouth. So all those sorts of things are really useful. The more information they have, the better they can help you obtain good oral health and maintain it. Last words on this one, from a patient point perspective is if you have a cold sore. In the UK, patients with a cold sore really shouldn't attend dental appointments unless it's completely healed, it's turned into a totally dry scab, and I mean a totally dry scab, not a little bit leaky at all. That's mainly because the herpes virus can be spread really easily during dental procedures, and that puts not only, you know, patient risk of infection, but other patients and the dental team. And what you don't want to do is that to spread even with all the PP. The other thing is it can actually be really sore to stretch somebody's mouth to see teeth when they've got a dry, a cold sore, or like if they've got angular colitis and cracked lips here. So all those things, it can be really uncomfortable. So if your mouth is sore, if you have a lot of ulcers, again, really useful even when you first get into the dental chair, say, listen, my mouth is really sore. My tongue seems really raw, or I've bitten something. It's really useful because then they're going to try and avoid hurting you. You know, much much to a lot of people's belief, dental professionals are not there to hurt you. So it's really important that you actually keep this in mind. And I say, if you've got a cold sore, you don't want to go there. If that gets into the eye, it can be really serious. So way better to prevent it. And I don't think anybody will be upset if you ring and say, I've got a cold sore, and I thought you would want to know. So much safer for everybody to avoid that direct contact with it. So, as I say, dentistry is a team effort. There's lots of different members of the team, and they are all about helping you obtain good oral health and maintain it. Okay. And you know, the cost in some cases can be very high, and usually that cost is for complex treatments. And often those complex treatments are a result of things that we haven't done as well at home as we might have done. So even if you've got a lot of fillings, you can prevent new decay developing. You can prevent those teeth getting so bad that they need to be extracted, because if they need to be extracted and you need a tooth replacement, that is going to cost more. But anyway, I could go off on one, let's not go there. But what hopefully you've got a little bit of an idea this evening is that, you know, there is an awful lot that goes on in a dental practice, and it is really important that you do your bit to actually prepare for your dental visit and actually see where some of that, all that effort comes in. The staff are really well trained. They spend a lot of time on continuing professional development. They know an awful lot, not just, I mean, I get quite upset at times when I hear people go, you know, the nurse just sucks stuff out. Dental nurses incredibly well qualified, incredibly well trained, and they know an awful lot. So, you know, please give the dental team the respect that they're due, and you will find that that will be reciprocal. But there you go, a little bit about what happens before you park your ear in the chair. Next week, I'm going to look a little bit more about what happens during, and that may or may not be a fun day out for you. We will see. But again, it gives you a little bit of context of, you know, what is involved, and, you know, why it is time consuming, and it may be expensive as well. I like to think of dentistry as an art as much as a science, because they are, you know, in some cases rebuilding teeth. You know, their ability to their dexterity is unbelievable. So now you have a little bit of an idea of what goes on behind the scenes. Maybe a little bit of an idea of how best you can prepare for your dental visits. And of course, until next week, look after yourself, look after each other. And before you go to bed tonight, don't forget to brush your teeth. Thanks for joining me. Until next week, see you soon. All the best. Thanks. Bye.